Hi, my name is Jasmin Barrera. This is going to be my checkoff video for venipuncture. Okay, so I want to start off by checking my physician orders. So I have Wanda Chi, 87292301, date of birth 9/20/19XX. I have orders for 8 o'clock to draw for prothrombin times and CBC. So for my CBC, I'm going to be using the purple tube, and then for the prothrombin times, I'm going to be using the blue tube. Okay, so I'm going to start off by stepping into the patient's room. Hi, Ms. Chi. My name is Jasmine. I'm going to be your nurse for today. So I have orders to be drawing up blood today. We're just going to be drawing 2 tubes. One of them is going to be for your CBCs, complete blood count, which we're just going to be taking a look at your white blood cells, red blood cells, platelet counts, and then we also want to check your prothrombin times, and that has to do with coagulation just in your blood. So I collected my supplies. I have the venipuncture kit. So in a real situation, it would be a new kit, but I am re-recording. I also have my alcohol pads, gauze, and then the tourniquet. And then I also have the biohazard bag. Okay. So as I'm looking at my patient, I also want to assess which arm I'm going to be drawing from. So any risk for venipuncture, that would be if they have an IV site on one of their arms. I would try to avoid that. Also, if they have a wristband that says restrictive limb. Okay, Ms. Chi, so I'm going to take a look at your wristband. Can you just verify your name and date of birth? Okay, so Wanda Chi, 9/20/19XX. Perfect. So I'm going to perform hand hygiene, and I'm going to be grabbing my gloves. Okay, so I'm going to be placing the tourniquet about 3 to 4 inches above where I will be drawing from. Okay, Miss Chi, it's going to be a little tight. I would check her pulse. I want to make sure that she does still have a pulse. If she didn't, then that means the tourniquet is a little too tight. And then I would have to remove it and start again. Okay. So I'm going to use the alcohol pad and then just in a circular motion. Okay, and while I allow that to dry, I'm going to go ahead and connect this. Okay. I want to make sure the bevel is up. And I'm going to be taunting below where I will be inserting the needle. Okay, you're going to feel a quick prick, Miss Chi. Okay. Make sure this is stable, and then I'm going to get my first tube. And then the tube will stop on its own once it's filled. Okay, and then I want to shake that about 6 times. And then I want to grab the other one. All right, perfect. Okay, I want to secure this. I'm going to remove the tourniquet. Place a gauze with no pressure. All right, Miss Chi, I'm going to remove the needle. Okay, and then apply pressure. I'm going to put the safety on. Okay. All right, Miss Chi, you're all good. Now I would return the bed back to the lowest position, raise the side rails. I'm gonna be labeling both tubes with name, date, and time. Initials, date, and time. And then I'm gonna be placing them in the biohazard bag. Make sure my patient is comfortable. Make sure that the call light is within reach. Remember to raise both side rails. Okay, Miss Chi, so I'm gonna be stepping out of the room. I'm gonna be taking these down to the lab. Your call light is within reach, and if you have any questions, feel free to click on the call light, and then I'll be back, okay? All right, and then I'll perform hand hygiene and step out of the room. Also, I didn't mention, but if the tubes had any type of blood on the outside, I would clean them with an alcohol swab before placing them in the biohazard bag and before labeling them.